All right, welcome to Life Extension Live. I'm Dr. Mike, and of course, I'm with my co host, Dr. Crystal Gossert. And today we're going to talk about something you may or may not have ever heard of. Not sure. It's called the lymphatic system. This is, I don't know, Crystal, what do you think? How many people watching have heard about the lymphatic system? What's your guess?
Very few.
Yeah.
The only reason I'm aware of the lymphatic system as a nutritionist, because we always talked about the lymphatic system and fat absorption, but
Yeah.
nothing more beyond that.
Yeah, it's one of the most fascinating systems to me in the body because it basically mirrors or travels with all the other blood vessels, right? Your arteries, your veins. But what the lymphatic vessels do is they act as a really good drainage for a bunch
Hmm.
of gunk that could be building up in your body. And that gunk could be viruses and bacteria, inflammatory markers, right? Molecules that have become too oxidative, and all that stuff has to collect and then be moved out of the system. That's the role of your lymph system or your lymphatic system. I think. Do we have a nice picture of that, Dr. Crystal, where we can show the lymphatic system and how it looks compared to the
Yes.
arteries and veins?
Yes, we do have an image. Robson is putting it up now, and it's really just showing the connection between the cardiovascular system. So we know about the arteries and the capillaries and the veins, and so what this image is really kind of showing us is that that connection where I guess the fluid from your capillaries then enter into the lymphatic system.
Right. Yeah. Yeah. And that's your drainage. So a lot of stuff that you don't want in your body, you don't want accumulating. It could even be cancer cells, right? It could
Yeah.
be infectious agents, whatever it is. You want that stuff removed from your overall body circulation. That's your lymphatic drainage. And so you have this drainage system that just kind of runs with arteries and veins, collecting all that stuff, moving it higher into your chest cavity where it gets back into systemic circulation and then out through your kidneys. So it's a really awesome kind of system that a lot of people don't even know. I don't think they know that we have, and without it we wouldn't be all that healthy. We know that for a fact. So today's show, we're going to talk about the purpose of the lymphatic system. We're going to talk about what can go wrong with the lymphatic system and then how to support the system through lifestyle and nutrition. Now, before we go further, you're the one that really brought this up, Dr. Crystal, right? I wasn't, the lymphatic system wasn't on my mind at all. And you saw what, a couple articles, I think one in Life Extension magazine, that kind of got you going, hey, that's pretty good. Tell us a little bit about why now? Why are we talking about lymphatic systems now?
Well, more and more research and the medical community is starting to appreciate the role that the system plays with health and how when the system is not functioning properly, how that can translate to autoimmune disease. We know, how it relates to cancer. We've all heard of lymphoma and different types of concerns once the cancer kind of enters the lymph nodes and the lymphatic system in that way. But chronic inflammation uh, could be partially due to poor
Yeah.
environment, poor circulation within this lymphatic system. And so we are seeing it in many diseases, insulin resistance. I mean, that the list goes on and on. Of course, cardiovascular disease, and we see problems with some of this lymph that's that fluid that's in the lymphatic system, some of that kind of building up with people who are dealing with chronic venous insufficiency, that can then translate to issues with the lymphatic system. So and we're actually in 2015 just discovered that the brain has a lymphatic
Has its
system.
own little drainage system. Yeah. Yeah. But
Right.
when you think about it, it makes sense, right? I mean, you got your blood that's circulating around, oxygen to the tissues, deoxygenated blood back to, like, that makes sense. But then it makes sense that you need a drainage system that's kind of paralleling that, right? to get
Yes.
rid of all of that gunky stuff. Listen, lymph tissue is gunky. There's a lot of bad stuff in it, and you don't want to just hanging around. That's where we get some of the edema problems, swelling, chronic diseases have been connected to this.
Mm-hmm.
And I know a lot of oncologists now are looking at the lymphatic system as a potential treatment for a lot of cancers. Meaning, you're on chemo, but then they're also going to do things to help clear out your lymphatic system. So everybody, if you look at your neck here too, right? Everybody knows about tonsils. We call these the adenoid tissues, what have you, your appendix. These are organs and tissues associated with your lymph system, and they trap that gunk in there. If you're like me, I've had large tonsils all my life, and I deal with a lot of sinus stuff, and it gets stuck in there. But that's the job of the lymph system: trap that stuff so the immune system can get to it, just in case there's something bad in there, right? And
Very
and
true.
and and that happens in the lymph nodes, and then that fluid carries on. So wherever you feel like a little node here and there, that's where that lymph system is coming together, and it's coming
Right.
together with the immune system to help fight things in case you need to fight them. So it doesn't surprise me the brain has a lymphatic system at all, right?
Right.
It kind of should. When you think about it, you're like, shouldn't every organ kind of have a drainage system, right? So I think we're
Yes.
going to see a lot more research in lymphatic system treatment. We'll have to
I
see.
agree. And I think where the research is also going is using the lymphatic system to deliver not just nutrients, to deliver drugs to the body, directly to the body.
Yeah,
And it's bypassing the hepatic portal system. Usually anything that's, ingested goes to the liver first and is transformed or metabolized. And sometimes more bioavailable, sometimes less available to the tissues once it's transformed. So giving it in the directly through the lymphatic circulation, you're
would be
able
a
to
good way to
get
go.
that
Yeah.
target, that drug directly where you need it to
Yeah.
go.
So just real quick, some basic bullet points of what the purpose of the lymphatic system is. Number one, protects the body by destroying and eliminating disease-causing pathogens. That could include infections and cancers, right?
Right?
It removes cellular waste. It does absorb fats from the digestive tract that helps to get them back into the bloodstream, and it balances levels of body fluids kind of throughout. You can almost think of it, if you're a little too swollen, the lymph system can take some of that fluid, right? And and,
Yes.
and, and bring down some of that swelling. So those are just the key points of what the
Hmm.
lymphatic system does. So we want to keep it healthy, because that very first bullet, Dr. Crystal, let me read it again: protects the body by destroying and eliminating disease causing pathogens. I want that. I would like my lymph system to be able to do that, right? And so
Right.
supporting the lymph system, I think, is going to be really, really important. And so tell us, as you were researching this and learning about the lymphatic system, can we
Hmm.
can we talk a little bit more about maybe how it all works? Like, so you got your arteries, you got your veins, and your lymph vessels. How does it really work? Is the lymph vessels deep into the tissue and just kind of drawing in some of that leftover fluid? Is that how it's working? Is it using the heart? Like, what did you learn?
Right. So yes, it's not using the heart directly, which is why, one of the strategies that we'll talk about to support the health of the lymphatic system is movement, is exercise. And so what we find, just to kind of go back to that original image, is the heart is pumping blood. Your arteries, they blood is moving, getting to tissues through the powerful pumping action of the heart. And then that blood flow, or those blood vessels, get smaller and smaller and smaller. And I'm going to use my fist as an example. We can imagine my fist as, say, my kidneys, and those tiny, 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 those micro capillaries, those tiny blood vessels are now all inside of my kidneys, right? And they're delivering oxygen, delivering nutrients. but those capillaries have small, tiny holes. And so some of that fluid, mainly the plasma, is seeping out of that capillary and kind of getting into those spaces between your cells. And that's once that fluid is getting into those spaces, some of that fluid is going to go into the cell. Some of that fluid now from the cell is coming out into the space with the fluid. And that's where the lymph vessels are located to come and start picking up
Pulling that
some of
out.
that fluid. And what happens, Dr. Mike, when you talk about the immune system, that fluid will then go straight to what I like to call a filtration checkpoint, and
Yeah,
that is going to be the lymph
the
node.
lymph nodes, right? Yep,
So all the fluid from that space goes through at least one lymph node.
yep,
Hopefully, it's going through multiple checkpoints, and at every checkpoint in those lymph nodes, you have immune cells there.
right.
You have T cells there. You have sometimes some of the phagocytic cells there, and really that's where the immune system is notified. Hey, there's
Who's
something
there?
wrong in this kidney,
Yeah,
in
yeah,
these cells. It's you mentioned it could be cancer, it could be an infection, it could be anything. But that's how other immune cells in the body know that
yeah.
we need to be on alert because something is going on in these cells. So the lymph nodes is really that checkpoint where we can identify
Wow.
those things.
Yeah,
And from there, you're able to mount an immune response. But so that's where, when we start talking about supporting the lymphatic system, I think I agree, kind of that first bullet point, the immunity part
yeah. It's
is
key.
at its core
Yeah,
function.
love it. Isn't the body amazing?
It's amazing.
I mean,
I mean,
it's pulling out this gunky fluid, and then it has the foresight to say we should check this fluid to make sure there's nothing crazy in it.
right.
That's your lymph nodes, right? That's a collection of all your immune cells ready to fight. I mean, it blows my mind how it just all comes together so wonderfully. And so again, so I think people can see, and I think the audience understands. Yeah, there's a lot of interest in the lymph system right now. How is it involved in diseases? And if we treat the lymph system, can that be helpful in
Right.
treating some chronic diseases? Now, there are some conditions that can affect the lymph system. Dr.
Mhm.
Crystal, do you want to tell us about lymphedema?
Yeah, so that is kind of the local swelling. We've all experienced some level of swelling, right? And that's that localized swelling, more of the abnormal accumulation of the lymphatic fluid under the skin. You see this occurring in individuals who are undergoing cancer treatment, so post radiation therapy. Sometimes you see some of that swelling, but there are many causes. Just poor fluid movement throughout the body, and that pooling, lack of physical activity is certainly going to cause that lack of proper hydration. So that's what we're dealing with lymphedema. It is actually a progressive inflammatory concern that someone can be dealing with. Very could lead to infection, discomfort. So that's one thing that I guess what something that could go wrong with the lymphatic system. Of course, the swollen lymph nodes, which
Yep.
is
Yep.
normal for the most part,
In some
Dr. Mike.
places in the body, yeah, yeah. I'm not, as a clinician, some swollen lymph nodes in the neck and the groin. That's especially in kids. That doesn't bother me too much. But lymph nodes that are painful, that are definitely nodular like, they're just a little weird. Those are the ones that we worry about the most. But just because you feel a little node right there, that doesn't really mean that much to me as a clinician. So a lot of different connections with the lymph system. You got the blood vessels, you got the venous system, you have the immune system. I mean, a lot of important things come together at the lymph vessel and at the lymph node. And so taking care of the lymph system is what I really wanted to get into now, Dr. Crystal. So somebody might ask, well, why can't you just go in there and put a needle in there and just drain it out once a year and we're all happy? Why can't we do something like that, Dr. Christo? And the answer is, I'm not the answer is simple. The lymph vessels, if they're not really full of something, they're actually pretty collapsed. And you can't necessarily get a tube in the system and just like force fluid out of it. It just doesn't work that way. So that's why medicines and I think supplements, nutrition, lifestyle is a better way to go to keep the lymphatic system moving and circulating. So let's start there, Dr. Crystal. Tell us about some of the manual therapies, working the lymph system that may be helpful.
Yes, massage therapy. And it's not the massage therapy that you would typically think of, because like the deep tissue or those really massage therapy techniques where they're kind of getting in, they're now talking to the muscles more so of those
Yeah,
lymphatic vessels, and kind of um manually draining some of those vessels. That's more of a very light type of massage therapy, that someone has to be specially trained to perform.
yeah,
But it's called manual lymphatic drainage. And it's more of like a tapping motion.
yeah,
You're
yeah,
just
yeah.
kind of
And
tapping.
there's a reason for because if you were to do too much pressure, you could collapse the lymph vessel. Again, lymph vessels aren't strong. They're not like your muscles or your arteries. You
Mhm.
can feel your arteries in your hands, your neck. I mean, you can feel those vessels. You can't feel the
Mhm.
lymph system. There's no pulse to them. And if they're a little clogged, and there's some edema, and you push too hard on a lymph vessel, you could just collapse it, and that's not going to help anything. So the light touch makes sense to me. Like I don't,
Yes.
I'm not trained in it at all, but when you say it's a specific light pressure, that makes sense.
Right, and those massage the massage actually starts up top, and there's an order to it. I mean, it's a very precise technique where you're kind of wanting to target the different lymphatic vessels along the body.
Yeah,
So that is
very
one
interesting.
way to just kind of help with lymphatic flow, improve inflammation, decrease any type of swelling and edema that someone may be experiencing. And then another is dry brushing.
This
And
one
this
I'm
is
not familiar with. I don't know what this is.
well, I've seen pictures of it and seen videos of it being performed. Occasionally, you'll see someone doing this at the day spa, but it's a technique that has been used in India for over 5,000 years, and it's just it's again, it's you're helping to move that lymph fluid
Just,
along
I assume using a dry brush.
using a
Is
dry brush.
okay, so there's
Right.
there's nothing there's nothing fancy here. It's a dry brush, and they're just that light touch again, just moving things.
Yes.
Yeah, yeah.
So
Okay.
those are some manual ways. Of course, as I mentioned, hydration, movement in general, exercise can be helpful.
Hey,
Eating hydrating foods, fruit
yeah.
and vegetables. From a nutritionist, you
There
have
you
to make
go. Back
sure.
back to fruits, vegetables. Take some deep breaths.
Oh yes.
Stand up, get your hands up, take some deep breath. All of that changes the pressure in your thoracic cavity, and it moves the gunk up where you want it. You
Mm-hmm.
want it to come higher into those bigger veins, right?
Mm-hmm.
Because it will go back into the circulation and then out eventually out of the kidney. So deep breathing is a big one. I think that matter of fact, I told you when I was a resident, right? Remember taking care of like some people, especially older people with pneumonia.
Mm-hmm.
They could be feeling great, ready to be checked out of the hospital, but I would make them do like one more breathing treatment, and it wasn't because of the pneumonia anymore. It wasn't because they have low oxygen.
Mm.
I'm trying to move all of that stale, yucky, gunky lymph tissue out. And breathing treatments can be very helpful for that, especially people in the hospital. Let's talk about nutrition, specifically some nutrients,
Yes.
because
Um,
I had no idea you were going to talk about this one, and it happens to be one of my favorite. Dr. Crystal, you have so many favorite nutrients. I don't. I only have like two or three, and this one happens to be one of my favorites because I think it's a rock star in its mechanism of action, and that's micronized diosmin. Tell us about that.
Yes, and that's I love it too.
There you
But
go.
that's not shocking, right? Shocking. It's sweet. Well, I love it just because of what it is. It's sweet orange peel extract. I'm just like, oh, can we? I
It's
just love it
sweet.
when nature
It's so
just
nice.
shows up and just does its thing. And so, who doesn't like sweet oranges?
Yeah.
And it can really help to promote the contractions, the lymphatic contractions. It can promote the blood vessel growth, so more of those lymphatic capillaries, meaning more filtration,
Yeah.
uh, filter areas, as well as improving the size of those lymphatic capillaries as well. And so diosmin, Dr. Mike, we
Love it.
just
Love it.
love it.
Yeah. And now it's not really in the pulp or the flesh of the fruit. It's in the rind, right?
Well,
Um,
that's where, we're getting the extract
right.
from
Right.
the rind.
But if
Yes,
I'm
and the
eating,
diosmin,
but so if I'm eating as a nutritionist, if I'm eating just the orange, am I getting some diosmin that way too, or is it?
you can get some. Yes,
Yeah.
it's the diosmin, some of those other bioflavonoids is what we call them, hesperidin, that we find those in the citrus food. So you will get some of
You'll
those,
get
but when
some.
you're
Okay.
kind of looking at kind of concentrating it in a supplement form, you want to make sure it's an extract where you're getting a specific amount of the diosmin
Yeah, and I think
from
we
that
yeah we
orange peel.
570 milligrams a day, I think is the common dose,
Mhm.
and that's for really helping the vessels to become stronger, helping with
Yes.
lymphatic vessel contraction, that kind of stuff. So
Mhm.
that's micronized diosmin, and then we got an old one, and we have not talked about this one in a long time, and it's our old friend horse chestnut seed.
Our old friend.
Our
Yes, I
old
can
buddy.
remember before I knew about diosmin, I knew about
That's
horse
right.
chestnut,
We
believe
had
it or not.
before the powerful impact of diosmin on lower leg circulation, lymphatic circulation, we used horse chestnut.
Horse chestnut.
What
Yes.
is it?
Uh,
Well, first of all, tell us what it is, and then what it's doing. But I think it's very similar to diosmin, right? In mechanism.
it's
Yeah.
helping to strengthen the lymphatic vessels, reducing edema. It's one that you can even combine with diosmin. And the dose is about 250 milligrams twice daily. So that is option number two.
Yeah. And then we have I love just the name of this one. I don't know. Do you know which one I'm going to? Yeah. Go to cola. It's just cool. I don't know. I just like it. Go to cola. This has, I guess, it's what's called a triterpene, right? That's a certain type of plant-based compound that's been shown to improve circulation. About 600 milligrams twice daily of Go to cola could be very helpful. Tell us about Korean Angelica. That's another one of my favorites. Now, I've used Dr. Crystal Korean Angelica for pain. It has some good pain
Yes.
qualities or anti-pain qualities to it. So tell us about what it's doing here for lymphatic system.
Yes. And so just really quick to go back, the go-to cola is 60 milligrams twice daily for the dosing
60
for
milligrams.
that.
Okay.
And then with the Angelica, Angelica is a natural source of coumarins. And if you think about Coumadin, right,
Yeah.
the
Yeah. There you go.
medication,
Yeah.
the anticoagulant medication that's helping to improve blood flow, those coumarins are also provided in Angelica.
That's awesome. Very
And
nice.
yes, so it's I guess most people are familiar with how it can help with discomfort and pain, a fast acting nutrient that can quickly help to promote comfort in the body. But if you're dealing with edema, if you're dealing with some swelling, if you're dealing
Yeah.
with lymphedema, that can be painful.
It is, yeah. A lot of people kind
So,
of people with bad lymphedema, it's very sore like to them.
mhm.
It
Yeah,
hurts to touch. They don't like moving too much, which is bad because you need to move with lymphedema, right?
exactly.
So something like Korean Angelica might provide some of that soreness relief to allow you to do some of this massage therapy, maybe.
Exactly, as well as helping to just support, the movement of that lymph.
Yeah. And then a bonus one, which I know we both love, is selenium. Tell us why is selenium a bonus one?
Well, a lot of the research, and I think I may have mentioned this earlier, a lot of the research that I'm finding with these nutrients relate to their use in cancer patients.
Yeah.
You find lymphedema a common side effect of, radiation therapy. And so I started digging and looking at some of our protocols at Life Extension. And I believe this suggestion came from our lymphoma protocol. And surprisingly, I said, Selenium!
You
We
found
like
it.
selenium.
Awesome.
Selenium is a nutrient specifically shown in several studies for reducing lymphedema at multiple sites post radiation. And the specific dosing that Robson is highlighting, 300 to 500 micrograms daily,
Love it.
administered for 4 to 6 weeks after radiotherapy.
Yeah. And overall, that helps to reduce the lymphedema that might happen, right? I think
Mhm.
it helps reduce pain. It helps to keep the lymph system circulating. So people are more likely to do the deep breathing and some of those other, lifestyle things. Listen, lymphedema from radiation therapy can be very painful. The quality of life definitely goes down. So it's nice to see nature coming in and helping out with maybe some of that. So this is fascinating. And again, why are we doing this? Overall, I know Dr. Crystal agrees with me. Life Extension agrees. We're going to see more and more research into this drainage system, the lymph system. I think in infectious disease categories, cancer, chronic inflammatory diseases, I think you're going to see a lot of people looking into the lymph system and how it relates to those diseases and how maybe it can be used in treatment. So we have a pretty decent article for you, right, Dr. Crystal? Lifeextension.com/lymph Lymph, lymph, will take you to a nice little massage therapy conference, and they had a section on the lymphatic system, right?
Yes, a section on the manual lymphatic massage,
Ooh, there you go.
just to kind of highlight exactly what it's all about and why you should find someone to perform that type of massage therapy for you.
Fantastic show today, Dr. Crystal. Great information. So, everybody that's watching, we hope maybe you learned something new today about the lymph system. And don't forget, we go live every Wednesday at 3 p.m. We got a lot of shows under our belt now. So please like and share and comment. And just, stay tuned for next Wednesday because we'll be back talking about a new topic. We talk about everything here, don't we? We're all over
Yes.
the place and we love it. Thanks, everybody, for watching. I'm Dr. Mike.